Most patients who have started to consider a total knee replacement have this question: what to expect after a knee replacement? For you to have an optimal outcome following the surgery, your expectations should be realistic. What the surgeon assures and what the patients expect should be the same in order to get a good outcome. What you can certainly expect is a significant improvement in your lifestyle. Most patients experience a tremendous relief from the pain what they were experiencing before the surgery. After a knee replacement, you can perform most of your activities of daily living, like walking without pain, stairs, going for shopping, traveling, and you can even play golf and even do a bit of light hiking and swimming, cycling. And probably most of you have this question: how much bend I can get in my knee? You can certainly get enough bend to perform your day-to-day activities, like sitting on a chair and getting up, getting in and out of a car, and climbing up and down the stairs. And also the bend depends on a number of other factors, like how much bend you had before surgery, and your body weight, the size of your legs, and many other factors. So, before considering a knee replacement, it's always better to talk to your surgeon with regards to your expectations and make a final decision.